Hello, my name is Amber LaRock and I am a staff writer with Emergency Vets USA as well as a licensed veterinary technician. Our goal at Emergency Vets USA is to educate you on topics regarding your pet's health. So hookworms are an intestinal parasite that not only impact the dog's digestive system, but they also suck the blood from the vessels in the intestines. Because hookworms will consume your dog's blood, this means that not only will your dog experience gastrointestinal symptoms like diarrhea and vomiting from their hookworm infection, but they can also experience life-threatening anemia. Hookworms should not only be taken seriously for the simple fact that they can drastically impact a dog's health, but they can also infect humans, so this is why it's so important to be educated on this topic and how to protect your dog in the future. So there are a few different ways that dogs can become infected with hookworms. Some of the most common ways is through the placenta when babies are developing. They can also get it through consuming their mother's milk. They can get it by consuming infected feces. They can get it by consuming infected soil or even stepping on infected soil. And they can also get it by consuming infected animals such as mice or birds. These hookworms may take a different route in the body based on how the hookworms entered the body, but at the end of their journey, they will arrive in the intestines where they will begin to suck the blood of the vessels that are in the intestines, and they will also mature and begin to release eggs to create the cycle. Some of the most common symptoms of a hookworm infection in dogs include vomiting, diarrhea, bloody diarrhea, anorexia, weight loss, pale gums due to the anemia, lethargy, tar-colored stool due to the fact that there is digested blood in their stool, a dull coat, weakness, and even collapse. It's typically really easy for your veterinarian to diagnose hookworms in your dog. All they have to do is perform a fecal float by obtaining a small and fresh stool sample, and they basically just look at the slide underneath the microscope and search for the presence of hookworm eggs. If your dog is diagnosed with hookworms, your veterinarian will typically prescribe a deworming medication that contains fenbendazole. There are a few different forms of this medication. The most common is known as Panicure, but as long as it contains fenbendazole, it will do the job. And based on the severity of their hookworm infection, your veterinarian may prescribe this to your dog for anywhere from 3 days to 10 days. It just depends on the situation and the preference of your veterinarian. For more in-depth review on hookworms in dogs and hookworm anemia in dogs, be sure to refer to the article that is attached to this video, but stay tuned to Emergency Vets USA for more topics on pet health.